Hi, live. We're live. Are we live? I hope we're live because I'm on the hospital Wi-Fi and I've got a thing going round and round. So that's, as my son would say, looks a bit laggy. I've got to look there. It looks a bit laggy. I hope it's not laggy. Anyway, let's just say that it's live. So I've been away for a couple of weeks because I had a really bad back. I had a problem years ago, and I had it again a couple of weeks ago. So that's been really bad for me. This year's been a bit funny. I don't know about you, but it's a bit funny. I can't believe it's nearly March. So anyway, it's a lot better now, and I'm so relieved. I know whenever the children are ill, they always look at the ones that are well, look at the one that's ill and think, oh, I wish I was ill and off school. But you know, when you are ill, really you don't want to be, you'd rather be well and going to work and doing stuff rather than being ill, because it's horrible not being well. And my back was really bad, so it's really good to be back, as it were. And so yeah, I'm back. So I've got some questions here, which we're going to get through. And by all means, ask away in a live fashion. We have question number one. We've got a patient who's inquiring. She's from London. She's got an appointment to have her implants removed on the NHS, her breast implants removed on the NHS, and wants to come and see me because she's worried, and I think she's just worried. So I said I would talk on this about it. She's welcome to come and see me. You are welcome to come and see me. But I said I would talk about it here, and so to save you, possibly save you a journey to come and see me. So the thing about the breast, whether you have whatever you have, any sort of surgery with the breast, is size or volume and buonasera, and shape. So those are the two aspects that you look at when you're treating the breast. And if you're having your implants removed, obviously the size is going to be smaller. So that's the first thing. Are you going to be at peace and comfortable with the size being smaller, back to the size like they were before? Now, if your weight has changed, the size might be different. So if you've put on weight since you had the implants in, or you lost weight since you had the implants in, your breast might be bigger or smaller. I'm getting hearts. That's a new one. Thank you. So your breast might be slightly different to how it was before, but broadly speaking, it'll be similar to how the breast was before, size-wise. And so you've got to say, are you going to be comfortable with the size? Because if you're not comfortable with the size, then you've got to think about whether you're going to have implants put back in again. So if you've decided you're not going to have implants put back in again, that's why the thing was going around. So mystery mask. What's going on? Oh my God. What is going on? I'm sorry, this is actually doing it. It's on auto now. We're on autopilot. What is that? Oh, it's a gold medal. Oh. Right, sorry, this is a little bit off-putting now. I don't know what is... Oh, what's that? Hold on a minute, I don't know what's going on. I'd like to stop this. Can you stop this, please? Oh God! Right, hold on. This is now railroading my Facebook Live broadcast. This is railroading it, and how do you get it off? I want to get it off. I don't want to finish it. Oh God! Comment. I don't want to do a comment. Sorry. Don't worry. I will. I don't know how to get this off. Okay. Shall I just carry on with these things going in the background? Sorry, I don't know how to get this off. If anyone knows how to get these masks off. Oh God. You're right. Hold on. There. Oh, that was a good one as well. Got it off on the good one. Oh, I like that one. That's my favourite. Anyway, sorry about that. Woo. Wow. That was... sorry about that. Right then, so yes, explant, how many breasts are going to look? So size and Amazing. Now that, come on, I look amazing with that big funny face on. Thank you, like, comment. So if you're at peace with the size being smaller when you're having your implants removed, then the next thing you've got to think about, so if you're not, then you've got to have new implants put in. But you think, look, you know what, I've had enough of implants, I want to have them out, then that's absolutely fine. Have them out and be okay with the size. And the next question is, are you going to be okay with the shape? So the question about the shape is whether you have a lift or not. And if you really think that you're not going to be happy with the shape, because what happens is the skin's been stretched by the implants, so the breast will droop, will sit low when you have your implants removed. So you can combine removal of implants with a breast lift. Now there are complications associated with the breast lift and scars associated with a breast lift. So that may or may not be something you want to have done, but that's the thing that you would consider. Now, if you've got an appointment to see someone at the NHS already and they've already agreed to remove your implants, my advice would be, unless you really think you're not going to be happy with the shape of your breast, then I would have the implants removed and see what you think. Because you might be happy with the shape of the breast, you might be pleasantly surprised, the skin might recoil. Particularly if you've got good quality skin, and that's usually in younger patients who don't smoke, who haven't had a lot of sun exposure. Those are the things that contribute to poor quality of the skin and less elasticity of the skin. So if you've got good quality of the skin, it might be that your skin will recoil and it might be acceptable to you. The other thing is when you wear a bra, it's the same as having a breast lift. So you might say, look, you know what, just get rid of these implants. I'll just wear a bra. But when out of a bra, hi Terry, it's I've chosen a thoroughfare here. It's out of bra. It will be. They will sit low. So you might say that you want a lift. So, but you could always have a lift at a later stage, particularly if the NHS have agreed to do the NHS won't do the lift, whatever. So if they've agreed to remove the implants, my advice would probably be, if you think you're borderline and you might be okay with the look of it once your implants removed, presumably you're having implants removed for a reason, so it'll cure that reason if you like. And so I would do that, have them removed on the NHS is probably what my advice would be. That you're welcome to come up to Birmingham and see me and talk about it, but that's probably my advice. If you have it removed on the NHS, you might be happy with everything. If you're not happy with everything, then you could always have a lift later. That is my advice to you. The next question, we've got someone who is talking about having a full body lift, thigh lift and breast implants. Is that a good idea? She's lost 16 stone in weight, so well done you for losing 16 stone in weight. That's crazy. 16 stone. Wow. Simple answer is yes, you could have all that done. I wouldn't recommend it, to be honest with you. I think a full body lift, a thigh lift and implants is a big deal. The big one is the full body lift. That's a big operation. That requires turning in theatre. It takes many hours, and it's quite a big deal for recovery. I have done full body lifts combined with breast procedures, but it is a big deal, and I think it's probably an idea to stage it. I know you might say, oh, I want to get it all in one operation, but that's quite a big operation. And I would say no, I think a full body lift, thigh lift and a implant is too big. Hi everyone. And so I would stage it. I would do the most pressing thing first is usually the advice. So probably I suspect it'll be the full body lift is the most sort of pressing thing. So I'd do that first and then consider maybe, I guess you'd have a full body lift and implants, really. I guess you could if you wanted to, but I think combine it with a thigh lift is too much in one op. But it can be done. It's technically possible, but it's a lot to do in one operation. So really, we need to talk about that in the clinic. But that's my view on it. It's a big op. Now we've got great. We've got low power mode. Great. It's going well. It's going so well. It's all those masks. I mean, low power mode. Right. I don't know if that's affected you at all. I've gone a bit dark here, but anyway, I better get on with it. Inquired about another company, worried. Why? Someone's inquired on behalf of their daughter. They've gone somewhere else. They're worried. They're worried about choosing a surgeon. So my advice to choosing a surgeon is credentials. Look for a plastic surgeon, FRCS Plast after their name. Someone who is or has been an NHS consultant is someone who is fully trained in plastic surgery. So that's one thing, one benchmark to look out for. Any plastic surgeon working at any of the big hospitals like BMI, Spire, Nuffield, Ramsey, they all have to be fully trained to work at those hospitals. The problem with plastic surgery is there's a lot of clinics and commercial organisations that do it, and a lot of non-plastic surgeons who work and do plastic surgery. So my advice is you could always ask your GP, look for FRCS Plast after name, get my book. Oh, I should have a copy of my book. Never accept a lift from strangers. Get my book. But yes, do your research. Look for FRCS Plast and someone who is or has been an NHS consultant is my advice. And the other thing is meet them and see if you get on with them. And if you don't get on with them, if your gut feeling isn't good, move on. Because there's a lot to be said for having a rapport with them. Because if you don't get on with them before the surgery, how's it going to be if you have a problem after the surgery? So that's really important. Get a rapport and a feel, and maybe see a few surgeons. Although I know it can be expensive if people charge for consultations. And then that brings me on to my last question, which is this is a patient of mine who's lost weight, has got implants in, can now see and feel the edges of the implants, got rippling. What can I do? Tricky problem. Implants. If you think about it, you've got an implant and you've got the skin, and if you have a big implant, or if you have not much skin or breast tissue, if there's, I'm not explaining this very well, am I? There's a sort of ratio between implant and soft tissue cover. So the big breast and lot of soft tissue cover and a small implant is great, but not many people want that. Most people who want, certainly with bigger implants, have got less cover, and so it's more difficult to cover. Oh, I wish I could answer this question again. I'm not doing very well. So basically, what I'm saying is that if you've got rippling, it is because you can see the implant. All implants look like a sort of rippled effect if you hold an implant up. The question is whether you can see those ripples. So what are your options? Your options are either increase the soft tissue cover over the top. So put on weight, maybe not a great option, but if you have lost a significant amount of weight, and if you do want to put on weight, maybe that will help, because losing weight does make this problem worse. So put on weight, or we can sort of artificially do that by doing fat grafting. So that's number one option, surgery. Fat grafting over the top of the implant. There are risks with that. You can damage the implant, you can get infection, which might need the implant to be removed. It might not give a significant amount of fat, so it might not cover it well enough, but it is it's one of the best surgical options for visible rippling. The other option of getting more cover over the top of the implant is to change the plane of the implant. So if it's on top of the muscle, you can put it under the muscle. If it's already under the muscle, then there's not a lot you can do. But if it is on top of the muscle, you could change plane, put it underneath the muscle. Again, there's risks with putting implants under the muscle, but there are benefits in that it gives better cover. And then you can look at the characteristics of the implants. Depends what implants you've got. If I've done it, which I have, it's probably quite a well-filled implant, so we probably haven't got anywhere to go with that. But there are some implants that aren't as well filled as others. That means they're a bit softer and a bit more fluid. They feel softer, but they're more prone to rippling. Also, there's different types of gel. Some gels are more cohesive than others, which again feel firmer but ripple less. Most of the implants I use are quite cohesive and quite well filled, so we probably haven't got that option because this is my patient. So our options are either to increase the soft tissue cover, or the other thing is downsize the implant. Maybe not be a very palatable option, but as I say, it's a ratio between the soft tissue cover and the size of your implant. So if you've got a big implant without much cover over the top, that's when you get problems. If you've got a lot of cover and a small implant, then you're less likely to get problems. But as I say, those people don't really exist. People who've got a lot of cover and big breasts who want a small implant. But hope I've explained that satisfactorily. So yeah, so come and see me, which I think she is going to come and see me, and we will chat about this in real time, in real life, and we will try and make a good plan for what to do. But those are the options. So that was interesting, wasn't it? That the masks took my battery life, and I am going to say a sayonara. It's good to be back. I'm looking for comments. I don't know. Oh, actually, I'm looking at the comment. There are comments. All this, hello, great. Sorry, I can see these comments. Yes, but yeah, on a question level. But thank you very much for the comments. It's a very, very social one tonight. And I am going to go, and I'm going to be back though next week, because I am back and I'm well again. So I'm looking forward to doing this every week. If you have any questions, email me, Facebook me, Twitter me, whatever you want to do, and I'll be very happy to answer them. But for now, I'm going to check myself out. And you know what? I don't even know what it's like out there. Is it snowing? Am I snowed in? It's like being in a casino when you're in the theatres. There's no windows anywhere. You can't see what the weather's like outside. I've been here all day. I've got no idea what it is like out there, and looking forward to seeing you all as well. And yeah, absolutely, Terry. And so I'm hoping I'm not sitting here and I'm actually snowing outside and getting snowed in. So I better get myself outside to see what it's like. But thank you all, and lovely comments which I'm going to like. I hope, I don't know, is that working, that like? Oh, I just unliked it, sorry. So see you all soon, and I will check out, and I'm sorry about the mask fiasco. Bye.